Question 1. A term newborn is 10 minutes old with a heart rate of 96 bpm, irregular respirations, acrocyanosis, and weak muscle tone. What is the nurse's priority action? A. Provide tactile stimulation and reassess. B. Begin chest compressions immediately. C. Administer supplemental oxygen via mask. D. Prepare for endotracheal intubation. Answer. A. Provide tactile stimulation and reassess. Rationale. A heart rate between 60 to 100 bpm with irregular respirations indicates the need for stimulation first. Chest compressions are indicated only if the heart rate remains below 60 bpm after effective ventilation. Oxygen or intubation is not initiated unless apnea or severe bradycardia persists. Question 2. A newborn of a diabetic mother exhibits jitteriness, weak cry, and temperature instability. Which actions should the nurse take? Select all that apply. A. Check capillary blood glucose level. B. Initiate early feeding. C. Administer IV insulin. D. Place the infant under a radiant warmer. Answer. A. Check capillary blood glucose level. B. Initiate early feeding. D. Place the infant under a radiant warmer. Rationale. These manifestations suggest neonatal hypoglycemia. Blood glucose assessment confirms the diagnosis. Early feeding stabilizes glucose levels. Maintaining normothermia reduces glucose utilization. IV insulin would worsen hypoglycemia and is contraindicated. Question 3. A 2-hour-old newborn has nasal flaring, expiratory grunting, and oxygen saturation of 88% on room air. Which intervention should the nurse implement first? A. Position the infant with the neck slightly extended. B. Obtain a chest X-ray. C. Insert an orogastric tube. D. Administer antibiotics. Answer. A. Position the infant with the neck slightly extended. Rationale. Proper airway positioning is the immediate priority to improve ventilation. Diagnostic tests and medications may be required later, but do not address the immediate respiratory compromise. Question 4. A preterm newborn has bounding pulses, a widened pulse pressure, and a continuous systolic murmur. What condition should the nurse suspect? A. Ventricular septal defect. B. Patent ductus arteriosus. C. Coarctation of the aorta. D. Tetralogy of Fallot. Answer. B. Patent ductus arteriosus. Rationale. PDA commonly presents with bounding pulses, widened pulse pressure, and a characteristic murmur due to persistent fetal circulation. The other conditions have different cardiovascular manifestations. Question 5. A newborn delivered at home arrives at the hospital 3 hours after birth with a reddened, moist umbilical stump. What is the nurse's priority concern? A. Delayed meconium passage. B. Risk for neonatal infection. C. Physiologic jaundice. D. Impaired thermoregulation. Answer. B. Risk for neonatal infection. Rationale. A moist, reddened umbilical cord increases the risk for infection, especially following a non-sterile delivery. Preventing sepsis is the highest priority. Question 6. Parents are receiving discharge teaching on sudden infant death syndrome prevention. Which instructions should the nurse include? Select all that apply. A. Place the infant on the back to sleep. B. Use a firm sleep surface. C. Position soft pillows in the crib. D. Avoid overheating the infant. Answer. A. Place the infant on the back to sleep. B. Use a firm sleep surface. D. Avoid overheating the infant. Rationale. Supine positioning, firm sleep surfaces, and avoiding overheating reduce SIDS risk. Soft items in the crib increase the risk for suffocation and are unsafe. Question 7. A newborn develops jaundice within the first 12 hours of life and has a positive direct Coombs test. What is the priority nursing intervention? A. Encourage frequent oral feedings. B. Initiate phototherapy. C. Reassess bilirubin levels in 24 hours. D. Monitor stool frequency. Answer. B. Initiate phototherapy. Rationale. Early onset jaundice with hemolysis places the newborn at high risk for bilirubin toxicity. Immediate phototherapy is required to prevent neurologic damage. Question 8. A newborn receiving phototherapy has loose green stools and increased urine output. What action should the nurse take? A. Discontinue phototherapy. B. Increase prescribed fluid intake. C. Apply emollient lotion to the skin. D. Reduce light intensity. Answer. B. Increase prescribed fluid intake. Rationale. Phototherapy increases insensible water loss and stool output. Increasing fluids prevents dehydration. Therapy should continue unless otherwise prescribed. Question 9. True or false? Persistent hypothermia in a newborn increases the risk for hypoglycemia and metabolic acidosis. A. True. B. False. Answer. A. True. Rationale. Cold stress increases metabolic demands, leading to increased glucose consumption and anaerobic metabolism, which raises the risk for hypoglycemia and metabolic acidosis. Question 10. A newborn's mother is hepatitis B surface antigen positive. Which interventions are required? Select all that apply. A. Administer hepatitis B vaccine within 12 hours of birth. B. Administer hepatitis B immune globulin. C. Delay breastfeeding for 24 hours. D. Use standard precautions during care. Answer. A. Administer hepatitis B vaccine within 12 hours of birth. B. Administer hepatitis B immune globulin. D. Use standard precautions during care. Rationale. The newborn must receive both the hepatitis B vaccine and HBIG within 12 hours to prevent transmission. Breastfeeding is permitted after prophylaxis. Standard precautions are always required. Question 11. A preterm newborn on continuous positive airway pressure, CPAP, develops abdominal distension, visible bowel loops, and increased gastric residuals. What is the nurse's priority action? A. Hold enteral feedings and notify the provider. B. Increase CPAP pressure. C. Reposition the infant prone. D. Administer prescribed antacids. Answer. A. Hold enteral feedings and notify the provider. Rationale. These findings raise concern for necrotizing enterocolitis. Feedings must be stopped immediately to prevent bowel perforation. Increasing CPAP or repositioning does not address the underlying risk. Question 12. A newborn experienced shoulder dystocia during delivery. Which assessment findings require immediate follow-up? Select all that apply. A. Asymmetric Moro reflex. B. Decreased movement of one arm. C. Capillary refill of 3 seconds. D. Crepitus over the clavicle. Answer. A. Asymmetric Moro reflex. B. Decreased movement of one arm. D. Crepitus over the clavicle. Rationale. These findings suggest brachial plexus injury or clavicle fracture. Capillary refill of 3 seconds is within acceptable limits for a newborn. Question 13. A term newborn develops tachypnea shortly after birth, but has clear lung sounds and normal oxygen saturation. The symptoms resolve within 12 hours. What condition is most consistent with these findings? A. Respiratory distress syndrome. B. Meconium aspiration syndrome. C. Transient tachypnea of the newborn. D. Neonatal pneumonia. Answer. C. Transient tachypnea of the newborn. Rationale. TTN results from delayed absorption of fetal lung fluid and presents with mild, self-limiting respiratory distress. The other conditions are more severe and persistent. Question 14. A nurse notes a high-pitched cry, tremors, and increased muscle tone in a newborn. The mother has a history of opioid use. What is the priority nursing focus? A. Supporting respiratory function. B. Monitoring for neonatal withdrawal. C. Maintaining strict isolation. D. Limiting parental contact. Answer. B. Monitoring for neonatal withdrawal. Rationale. These findings are consistent with neonatal abstinence syndrome. Ongoing assessment using a standardized tool guides treatment. Isolation and limiting contact are inappropriate. Question 15. A newborn receiving IV fluids through an umbilical venous catheter develops blanching and coolness around the insertion site. What should the nurse do first? A. Apply a warm compress. B. Stop the infusion immediately. C. Flush the catheter. D. Lower the IV flow rate. Answer. B. Stop the infusion immediately. Rationale. Blanching and coolness indicate extravasation. Stopping the infusion prevents further tissue damage. Flushing or adjusting the rate worsens injury. Question 16. During the first hour of life, which assessment finding requires immediate intervention? A. Acrocyanosis of hands and feet. B. Respiratory rate of 68 breaths per minute. C. Blood glucose level of 34 milligrams per deciliter. D. Irregular respirations during sleep. Answer. C. Blood glucose level of 34 milligrams per deciliter. Rationale. A glucose level below 40 milligrams per deciliter requires prompt intervention to prevent neurologic injury. The other findings can be normal transitional variations. Question 17. A nurse is preparing to delegate care for a stable term newborn. Which task is appropriate to delegate to unlicensed assistive personnel UAP? A. Assessing feeding effectiveness. B. Obtaining axillary temperature. C. Evaluating respiratory effort. D. Teaching parents cord care. Answer. B. Obtaining axillary temperature. Rationale. UAP may collect routine, non-invasive data on stable clients. Assessment, evaluation, and teaching must be performed by the nurse. Question 18. A newborn with respiratory distress suddenly develops decreased breath sounds on the right side and oxygen desaturation. What complication does the nurse suspect? A. Atelectasis. B. Pneumonia. C. Pneumothorax. D. Pulmonary edema. Answer. C. Pneumothorax. Rationale. Sudden unilateral breath sound changes and desaturation suggest air leakage into the pleural space. This is a medical emergency. Question 19. True or false? Delayed passage of meconium beyond 48 hours of life may indicate an underlying intestinal obstruction. A. True. B. False. Answer. A. True. Rationale. Failure to pass meconium within 24 to 48 hours may signal conditions such as Hirschsprung disease or other obstructive disorders. Question 20. A nurse is caring for a newborn whose parents refuse vitamin K administration. What is the nurse's priority action? A. Administer the medication anyway. B. Document refusal and provide education. C. Notify Child Protective Services immediately. D. Delay documentation until discharge. Answer. B. Document refusal and provide education. Rationale. Parents have the right to refuse treatment. The nurse must provide education on risks, ensure informed refusal, and document appropriately. Forced administration violates ethical and legal standards. Question 21. A 28-week preterm newborn on mechanical ventilation suddenly shows increased oxygen requirements, diminished chest movement, and a drop in oxygen saturation. What is the nurse's priority action? A. Assess breath sounds bilaterally. B. Increase the ventilator oxygen concentration. C. Suction the endotracheal tube. D. Notify the respiratory therapist. Answer. A. Assess breath sounds bilaterally. Rationale. Immediate assessment is required to identify life-threatening complications, such as pneumothorax or tube displacement. Increasing oxygen or calling for help without assessment delays identification of the cause. Question 22. A preterm newborn receiving total parenteral nutrition through a central line develops temperature instability, apnea, and feeding intolerance. What should the nurse do first? A. Increase incubator temperature. B. Stop enteral feedings. C. Obtain blood cultures as prescribed. D. Assess for signs of sepsis. Answer: D. Assess for signs of sepsis. Rationale: these findings strongly suggest late-onset neonatal sepsis. Assessment and early recognition are the priority before implementing additional interventions. Question 23. A ventilated neonate's high-pressure alarm is sounding. What action should the nurse take first? A. Silence the alarm. B. Check for kinks or obstruction in the tubing. C. Increase sedation. D. Call the provider. Answer: B. Check for kinks or obstruction in the tubing. Rationale: high-pressure alarms often indicate obstruction or secretions. Quickly checking the system may immediately resolve the problem and restore ventilation. Question 24. A nurse is assigning care in the NICU. Which task is appropriate to delegate to a trained UAP for a stable preterm infant? A. Adjusting ventilator settings. B. Assessing signs of respiratory distress. C. Obtaining daily weight. D. Evaluating feeding tolerance. Answer: C. Obtaining daily weight. Rationale: UAP may collect routine data on stable infants. Assessment, evaluation, and ventilator management require nursing judgment and cannot be delegated. Question 25. A preterm newborn on CPAP develops frequent apnea and bradycardia episodes. What is the nurse's priority intervention? A. Stimulate the infant and document the episode. B. Increase CPAP pressure independently. C. Prepare for possible intubation. D. Reposition the infant prone. Answer: C. Prepare for possible intubation. Rationale: recurrent apnea and bradycardia despite CPAP indicate failure of non-invasive support. Preparing for advanced airway management is the priority. Question 26. A neonate with respiratory distress syndrome is receiving surfactant therapy. Which nursing action is the priority immediately after administration? A. Suction the endotracheal tube. B. Monitor oxygen saturation and lung sounds. C. Decrease ventilator rate. D. Position the infant flat. Answer: B. Monitor oxygen saturation and lung sounds. Rationale: surfactant improves lung compliance rapidly, increasing the risk of oxygen toxicity. Close monitoring is essential to adjust ventilatory support promptly. Question 27. A preterm newborn has a sudden drop in heart rate and oxygen saturation during gavage feeding. What is the nurse's first action? A. Stop the feeding immediately. B. Increase oxygen delivery. C. Suction the airway. D. Continue feeding more slowly. Answer: A. Stop the feeding immediately. Rationale: bradycardia and desaturation during feeding indicate intolerance or aspiration risk. Feeding must be stopped first to prevent further compromise. Question 28. A nurse is caring for 4 NICU patients. Which infant should the nurse assess first? A. A stable preterm infant awaiting discharge teaching. B. A ventilated neonate with new, unequal chest movement. C. A term newborn receiving phototherapy. D. A preterm infant tolerating gavage feeds. Answer: B. A ventilated neonate with new, unequal chest movement. Rationale: unequal chest movement in a ventilated infant suggests pneumothorax, a life-threatening emergency requiring immediate assessment. Question 29. True or false? Preterm newborns are at increased risk for intraventricular hemorrhage due to fragile cerebral blood vessels. A. True. B. False. Answer: A. True. Rationale: immature cerebral vasculature in preterm infants increases susceptibility to bleeding, especially with fluctuations in blood pressure or oxygenation. Question 30. A nurse is delegating tasks during a high-acuity NICU shift. Which task must the nurse perform personally? A. Measuring abdominal girth. B. Changing an incubator temperature setting. C. Assessing ventilator-dependent infant for respiratory distress. D. Recording intake and output. Answer: C. Assessing ventilator-dependent infant for respiratory distress. Rationale: Assessment of unstable or ventilator-dependent infants requires nursing judgment and cannot be delegated. The other tasks may be delegated if the infant is stable. Question 31. A 23-week preterm newborn with severe intraventricular hemorrhage has worsening metabolic acidosis despite maximal ventilatory support. The parents ask about withdrawing life-sustaining treatment. What is the nurse's priority response? A. Explain that treatment must continue until cardiac arrest occurs. B. Provide factual information and notify the healthcare provider. C. Encourage the parents to make an immediate decision. D. Avoid discussing prognosis to prevent distress. Answer. B. Provide factual information and notify the healthcare provider. Rationale. The nurse supports informed decision-making by providing accurate information and involving the interdisciplinary team. Withholding information or pressuring decisions violates ethical principles. Question 32. A ventilated neonate with a poor neurologic prognosis is receiving comfort-focused care. Which nursing action best supports ethical end-of-life care? A. Limiting parental bedside presence. B. Discontinuing all monitoring equipment immediately. C. Prioritizing pain relief and family involvement. D. Avoiding discussion of the infant's condition. Answer. C. Prioritizing pain relief and family involvement. Rationale. Ethical end-of-life care emphasizes comfort, dignity, and family presence. Limiting involvement or avoiding communication is inappropriate. Question 33. A newborn with multiple congenital anomalies has no chance of survival. The parents request that all resuscitative efforts be continued. What is the nurse's priority action? A. Refuse to participate in aggressive care. B. Support parental wishes without question. C. Facilitate an ethics consultation. D. Encourage withdrawal of care. Answer. C. Facilitate an ethics consultation. Rationale. Ethics consultation supports shared decision-making when conflict exists between prognosis and parental wishes. The nurse should not independently refuse or pressure decisions. Question 34. A preterm neonate receiving palliative care develops signs of pain. What intervention should the nurse implement first? A. Reposition the infant. B. Administer prescribed analgesics. C. Reduce environmental stimulation. D. Provide non-nutritive sucking. Answer. B. Administer prescribed analgesics. Rationale. Effective pain control is the priority in palliative care. Comfort measures support, but do not replace pharmacologic pain management when indicated. Question 35. A nurse is caring for a dying neonate whose parents request baptism at the bedside. What is the nurse's best action? A. Explain that religious rituals are not permitted in the NICU. B. Delay the request until visiting hours. C. Facilitate the request according to unit policy. D. Refer the parents to social services only. Answer. C. Facilitate the request according to unit policy. Rationale. Supporting spiritual and cultural needs is an essential component of holistic and ethical care, especially at end of life. Question 36. A nurse experiences moral distress when caring for a neonate receiving aggressive treatment with minimal chance of survival. What is the most appropriate action? A. Suppress personal feelings to remain professional. B. Request assignment change without explanation. C. Seek support through ethics or counseling resources. D. Confront the parents about treatment choices. Answer. C. Seek support through ethics or counseling resources. Rationale. Addressing moral distress through appropriate professional support maintains ethical integrity and nurse well-being. Question 37. True or false? Advanced care planning in neonatal care may include discussions about do not resuscitate orders when prognosis is poor. A. True. B. False. Answer. A. True. Rationale. Advanced care planning supports informed, ethical decisions aligned with the infant's best interest and family values. Question 38. A neonate with severe hypoxic ischemic encephalopathy is receiving therapeutic hypothermia. Which finding requires immediate nurse notification? A. Heart rate of 92 BPM. B. Core temperature of 33.5 degrees Celsius. C. Increased seizure activity. D. Decreased spontaneous movement. Answer: C. Increased seizure activity. Rationale: increased seizures indicate worsening neurologic status and require immediate intervention. Bradycardia and reduced movement are expected during hypothermia. Question 39. A nurse is caring for a neonate receiving comfort-only care. Which intervention best promotes dignity? A. Frequent invasive assessments. B. Maintaining strict feeding schedules. C. Minimizing unnecessary procedures. D. Continuous cardiorespiratory monitoring. Answer: C. Minimizing unnecessary procedures. Rationale: comfort-focused care prioritizes dignity and relief from suffering by avoiding non-essential interventions. Question 40. A nurse is prioritizing care for 4 NICU infants. Which infant should be seen first? A. A stable infant awaiting family teaching. B. A neonate with a new do not resuscitate order. C. A ventilated infant with sudden loss of waveform and alarms. D. A preterm infant sleeping after feeding. Answer: C. A ventilated infant with sudden loss of waveform and alarms. Rationale: sudden loss of ventilator waveform indicates possible airway or equipment failure, which is an immediate life-threatening emergency requiring rapid intervention. Question 41. A mass casualty event overwhelms the NICU, and only 1 ventilator is available for 2 neonates. Which infant should receive the ventilator based on disaster triage principles? A. A 24-week neonate with grade 1V intraventricular hemorrhage. B. A term neonate with meconium aspiration and high survival potential. C. A preterm neonate with multiple congenital anomalies. D. A neonate receiving comfort-only care. Answer: B. A term neonate with meconium aspiration and high survival potential. Rationale: disaster triage prioritizes the greatest likelihood of survival with limited resources. The term infant with a reversible condition has the best prognosis. Question 42. During a prolonged power outage, incubator heat is unavailable. Which nursing action is the priority to prevent cold stress in preterm infants? A. Increase frequency of feeding. B. Initiate skin-to-skin contact with caregivers. C. Administer warmed IV fluids. D. Limit handling to once per shift. Answer: B. Initiate skin-to-skin contact with caregivers. Rationale: skin-to-skin care is an evidence-based method to maintain thermoregulation when technology is limited. Question 43. A nurse is triaging NICU patients during an evacuation. Which infant should be evacuated first? A. A stable infant in an open crib. B. A ventilator-dependent infant with high oxygen requirements. C. A term infant under phototherapy. D. A preterm infant tolerating oral feeds. Answer: B. A ventilator-dependent infant with high oxygen requirements. Rationale: infants requiring life-sustaining technology are the highest priority during evacuation due to immediate risk if support is interrupted. Question 44. Parents demand full resuscitation for a neonate declared brain dead after confirmed testing. What is the nurse's priority action? A. Continue life support indefinitely. B. Explain that brain death equals legal death and involve leadership. C. Avoid discussion to reduce conflict. D. Transfer care to another nurse. Answer: B. Explain that brain death equals legal death and involve leadership. Rationale: brain death is legally recognized as death. Clear communication and administrative support are required in ethically complex situations. Question 45. A nurse is caring for multiple infants after a chemical exposure disaster. Which intervention takes priority? A. Completing detailed documentation. B. Initiating decontamination protocols. C. Contacting families for updates. D. Providing developmental stimulation. Answer: B. Initiating decontamination protocols. Rationale: preventing further exposure and contamination is the immediate priority to protect infants and staff. Question 46. A nurse is assigned to triage newborns following an earthquake. Which infant should be categorized as expectant? A. A neonate with mild respiratory distress. B. A preterm infant requiring minimal oxygen. C. A neonate with catastrophic injuries incompatible with life. D. A term infant with hypoglycemia. Answer: C. A neonate with catastrophic injuries incompatible with life. Rationale: expectant classification applies when survival is unlikely despite intervention, allowing resources to be allocated to those with better outcomes. Question 47. True or false? Crisis standards of care may ethically alter usual NICU practices during disasters to maximize overall survival. A. True. B. False. Answer: A. True. Rationale: crisis standards allow deviation from usual care when resources are limited, guided by ethical frameworks focused on population outcomes. Question 48. A nurse is caring for a neonate during a fire evacuation when time is limited. Which action best demonstrates ethical triage? A. Evacuating the infant closest to the exit. B. Evacuating the most critically ill infant first. C. Evacuating infants with the best chance of survival. D. Evacuating infants based on parental presence. Answer: C. Evacuating infants with the best chance of survival. Rationale: ethical disaster triage prioritizes survival potential rather than convenience or emotional factors. Question 49. A NICU nurse experiences psychological distress after participating in disaster triage decisions. What is the priority action for long-term professional practice? A. Avoid discussing the experience. B. Seek debriefing and mental health support. C. Request permanent reassignment. D. Focus solely on clinical skills. Answer: B. Seek debriefing and mental health support. Rationale: structured debriefing and mental health support reduce long-term moral injury and promote resilience. Question 50. A nurse is prioritizing care during a mass casualty event. Which newborn should be reassessed first? A. A stable infant awaiting discharge. B. A neonate with new apnea and bradycardia. C. A term infant feeding well. D. A preterm infant sleeping in an incubator. Answer: B. A neonate with new apnea and bradycardia. Rationale: new apnea and bradycardia indicate acute instability and require immediate reassessment and intervention. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.